Welcome to Engage, leading conversations that matter. Join in the conversation. Send an email to engage@cfpublic.org. Send a recorded talkback message on the free Central Florida Public Media app. Leave a voicemail by calling 407-273-2300, extension 246. Engage is made possible with the support of listeners like you.
You're listening to Engage on Central Florida Public Media. I'm Sharon Stone. Coming up, we'll break down Amendments 1 and 6, the ballot initiatives addressing partisan school board elections, and the initiative that would curb public campaign financing. Also, we'll talk to a researcher who flies through hurricanes and his experience flying inside Hurricane Milton. And a former Disney animator enters an award-winning short film critical of the response to COVID. He tells us how he went from drawing princesses to documenting a pandemic. First, a review of influenza in Florida. We are in that time of year where flu season begins. Local doctors say that last year it started during the week of Halloween. Dr. Tim Hendrix is the medical director of Advent Health Centricare. He joined Engage this morning to talk about trends happening in Central Florida, how the virus is evolving, and his advice to get through this flu season. I started our conversation by asking Dr. Hendrix why flu season begins in the fall.
Every year we have a flu season because as the weather changes, people come indoors or gathered together, they're traveling for the holidays, and viruses, these respiratory viruses, like the cold weather, they transmit easier. So we'll typically see an increase in colds and flu come here in October. We're already seeing people at our Advent Health Centricares coming in with flu-like symptoms, cold symptoms, sinus symptoms. RSV is on the rise, respiratory syncytial virus. So we're seeing all these viruses start to spread, mainly because kids are in school and we're getting into that fall weather.
I have a follow-up question for you about the weather. We're not dealing with New England winter in Florida, where people are bundled up and inside in this frigid cold. Help me understand why the conditions are still more favorable even here for flu this time of year.
Well, again, that's that dry air and the colder temperatures. But again, we have more activities where people are together. And this is a nationwide, northern hemisphere event, so to speak, as we get into our flu season. So it's not just our local conditions, but, because people are traveling, we're looking at, the spread throughout the United States.
What factors determine the severity of a cold and flu season?
A number of things are, but it's extremely unpredictable. So the only thing I can say with any confidence about flu season is we will have one. When, how bad, when it starts, is it going to be late? That's extremely variable. Now, we look at the southern hemisphere, so data from the southern hemisphere, because they just wrapped up their flu season, their winter season, indicates it's a typical flu season, maybe a little bit earlier onset in Australia, Argentina, et cetera, when we look at those countries, and they've had a rough flu season, but it's probably average for flu, and it's going to be the H3N2 virus, which is the virus that we're vaccinating against. So that's a good indicator. We're on track with our vaccine effectiveness.
Actually, since you brought up the vaccine, why do we have to get the flu vaccine every year? There are some that we just kind of once in a lifetime.
Every vaccine's different in how it stimulates an immune response, but we know that the flu vaccine will be effective and boost antibodies to influenza for 5 to 6 months after it, so that immunity will wane. So that's why why we have to get that yearly vaccine. Plus, the virus will mutate and we'll have changes in what virus is out there circulating. And what's really interesting, I think, is that we've been giving the 4-strain flu shot, what we call the quadrivalent, for several years to cover both influenza A, 2 types of influenza A, and 2 types of influenza B. But this year, because one of the strains of type B flu, Yamagata, has basically disappeared. It doesn't circulate in the last couple of years. So now we're just doing a trivalent flu vaccine, again, because of the success of vaccinations, and also during the pandemic with our mitigation effects, we saw a real decrease in flu transmission during that time. So that's kind of like a little success, so to speak, of the flu vaccine, that we have one less flu virus out there circulating.
Let me stay with the vaccine and a couple of questions for you. What do you say to people who think they've gotten sick from the flu shot and they don't want to get it again?
I'd say it wasn't the flu shot that made you sick. It's just a coincidence, so to speak, that the odds are strong in the fall for people to get upper respiratory viruses. It's probably just that you had the shot and you got a virus and you got sick. It was just that timing issue, because we see a lot more coughs and colds going around this time of year as people are getting their flu vaccines. Also that you will, with any vaccine, feel your body stimulate that immune system, meaning you're going to feel a little achy. You might feel a little tired the next day, but very mild symptoms. But it won't last more than a day or so, and you should not get sick with it.
Do you ever find a correlation between vaccination rates and socioeconomic factors in general?
Yes, I definitely. There's some disparities in coverage of flu vaccine, and the socioeconomic issues become important because those patients are at higher risk of complications for the flu. So we want to make sure that everybody is accessing the flu vaccine. And even something as simple as pediatric vaccinations, for instance, in the last few years have declined. And, one statistic I was looking at just yesterday is that prior to the pandemic, about 65% of our kids were getting vaccinated against the flu. This last season, it was only 52% that the CDC is reporting. So that decline in vaccination allows more of our kids to get sick and bring it home to the families and, expose grandma, so to speak, to the flu virus. And of course, grandma is one of our high-risk groups.
What do you do with that information as a doctor? How do you combat? A lot of it was misinformation that came out during the pandemic.
Very true. And, it's just a matter of reassuring people and not being confrontational about it, but just say, here's what we know. The flu vaccine that we're using now has been used since the 70s, early 70s or late 60s. It really hasn't changed much in how we produce this. So we have a lot of data about risk and benefits of the medication, of the vaccine. So it's a very safe, long track record with this vaccine. But the risks are that it's not just the flu, it is a serious flu infection that people can get. And I remind people, it's not just getting a cold. We're preventing influenza, which is high fever, body aches, illness that can last up to a week. And actually, we do see deaths from flu every year. Last year, I think there were maybe 50,000 deaths nationwide from influenza and 200 deaths pediatric. So kids getting the flu and dying from it, that does happen. So we want to make sure we protect everybody from those complications.
This is Dr. Tim Hendrix, Medical Director of Advent Health Centra Care. You had mentioned at-risk populations. Can you expand on that? Who is most vulnerable to flu?
Well, first and foremost, our older populations. So people over the age of 65, even people over 50, we're getting into that higher risk group. So that's where we focus, our Medicare population. We want to make sure they get their flu shot. And generally, they are going to their doctor is giving them their flu shot. Uptake or usage of the vaccine is pretty robust amongst that age group, but that is our primary risk. But then anybody else that has a underlying risk factor. So this sounds very similar to when we talk about who should get their COVID shot or who's at risk of complications from COVID, very similar to flu. Anybody with heart disease, diabetes, lung disease, any other issues that they take a medicine for every day, they should probably talk to the doctor about getting a flu shot. And then pregnant women, it's important that they get their flu shot because we know since H1N1, and if we remember back to 2009, I was there during the H1N1 pandemic that started, that we were seeing a lot of pregnant women ending up in the ICU because they got the flu infection from H1N1. H1N1 is one of those viruses that we vaccinate against because we still see it circulate in our community every season, but also any type of flu puts pregnant women at higher risk. And then, of course, children under the age of 5 are also at higher risk of complications from the flu. It's a big group.
So we're talking about this time of year, seeing more people with these upper respiratory infections. How in the world do I know if I have the flu, COVID, a cold, or allergies? How do I know what I'm dealing with?
That they all have very similar symptoms. But I tell people, if you have the sudden onset of a fever, body aches, cough, sore throat, It's probably the flu, especially as we get into here to the 1st of November, as we get into the holidays. If you have those symptoms, you should get into our Central Care urgent cares to get tested to determine if it is influenza, because you can't tell. It could be COVID, it could be a virus, but if we can run the test, we can tell definitively whether it's flu and whether to put you on an antiviral like Tamiflu, a prescription medicine that can help shorten the course. And also, if you have risk factors, you're an older person, have an underlying condition, more important that you get tested so we can get you on the antiviral to keep you out of the hospital.
I think a lot of people might look at the flu as an inconvenience and maybe not too much more. Does that concern you as a doctor?
I tell the story about when I see people at Centra Care and I see them coming into our urgent cares in flu season and they are miserable. I mean, I can literally go out in the lobby and I can point to who has the flu. I can tell you they got the flu. They just look sick and uncomfortable. But when we diagnose them with the flu, my first question is, did you get a flu shot this year? And I can guarantee you most of us say no, right? And I'll say, are you going to get one next year? And they're like, oh, please, yes, I never want to be this sick again. So it is not a trivial infection. It will take you out of work for up to a week possibly, but then of course the complications are also possible, especially if you're in a high-risk group.
Dr. Hendrix, how has COVID affected the flu? Is there any way to measure that? Does it have any impact on the season?
I don't think so. I think they're two separate infections. There's some seasonality that's starting with COVID. I was just looking at data this last week from Centra Care, looking at the COVID waves that we've had in the last 2 years. And it's interesting that we're having 2 waves a year. It's wintertime and spring, summertime. So we just came out of a COVID wave during the summertime. Was it JN1, JN2? I forget all the different variants that are circulating in the community. But when we look at this pattern, the twice a year, and then of course flu has the seasonal pattern of wintertime, once a year. I don't know if that's going to hold into the future, but it's important to remember that you still want to get that COVID vaccine yearly, just like you get your flu vaccine, to continue to boost your immunity.
Correct me if I'm wrong here. Activity trends from the state health department. I was looking at a map. It shows flu increasing in Lake and Sumter County.
Yeah.
What is that match what you are seeing within Central Florida?
What'll happen is as early in the flu season, you're going to see different counties pop up on that map, and they might disappear from the map. So it's just kind of that hot and cold with influenza. What we're seeing at Centra Care is a couple of weeks ago, we saw an increase in the flu, and I thought, oh, okay, it's starting. And then it kind of dropped through the hurricane and a lot of the other events going on had nothing to do with the flu, but maybe just fewer people getting the flu. Now, as we get into this last week, we're starting to see an increase at our Central Cares here in Central Florida in flu cases. Not a lot, but it's just that steady increase. What's interesting is to look at last year's flu data, and this week, same week last year, was a steady increase until we got into our peak flu season in mid-December. We had our early season last year, and it started the last week of October. So I'm like, okay, we don't know. It could be an early season. It could be a late season. But the warning is now it's time to go out and get your flu shot. Don't think about getting your flu shot when everybody around you is getting the flu. And that's typically what we'll see. We'll see 2 peak seasons for people getting their flu shot. One is now, when they should be getting their flu shot, and the other is when everybody's sick, they're like, oh, I should go get a flu shot. Well, yes, go get your flu shot, but you really should have thought about that now during the fall, so you're ready, you're protected, you don't have to worry about it.
Reviewing what you and I have talked about so far, I'm thinking, all right, we're getting into this flu season, got to get ready. Then we mentioned possible COVID wave coming up in the winter and RSV on the rise. It sounds like now is the time to maybe take some action because we have some things ahead of us. But the good news is we can take action.
Well, yeah, you're right. People ask, what is the best way to prevent getting the flu? Get a flu shot. That's plain and simple, Get your flu shot. It is, 50% effective year to year. It varies around that at preventing the flu. But people are like, well, that's not a great average. I want 100%. Well, in actuality, even if you get the flu, you'll have lower risk and have a less severe infection because you have those antibodies that are protecting you. So your likelihood of hospitalization is lower. But so just the pure effectiveness can get confusing to people because they're like, well, it's not stopping the flu. Well, it is building those antibodies and it'll help protect you from it getting worse.
And Dr. Hendrix, just to kind of wrap up, what do patients perhaps ask you about that would be beneficial information to share that I haven't thought to ask you yet?
Well, I think the biggest concern is when I should get my flu shot. Am I getting it too early? Is it going to last the whole season? Is the flu shot going to be effective against this year? Because we have seen years past where the virus is mutated during the season and we have an increased number of cases because the vaccine isn't as effective. There's a lot of variables we just don't know. But as I said before, we know we're going to have a flu season. Prepare now. Get your flu shot before you get into the holidays. Get that taken care of, and you have to worry about it because as we get into the holidays, we're going to see more travel, more transmission, families. And as I always say, if you don't get your flu shot for yourself, get it for grandma, all right? That you not getting the flu is going to help keep any of the loved ones in your life that have risk factors from getting the flu. So surround that person with vaccinated people.
Dr. Tim Hendrix is the medical director with Advent Health Centricare. There's more ahead here on Engage. We'll meet a hurricane researcher who fearlessly flies into the eyes of tropical storms. If you miss any part of our show today, you can always subscribe to the Engage podcast and listen whenever it is convenient for you. The program will be available on demand at cfpublic.org. This is Engage on Central Florida Public Media. You're listening to Engage on Central Florida Public Media. I'm Sharon Stone. Ahead on this program, Thomas Thorsbecken was a Disney animator who had worked on classics like The Lion King and Lilo and Stitch. But when COVID hit, the focus of his work changed dramatically.
I was more interested in meeting actors and having fun on location. But from day one, it became clear that people were not able to adjust, and it just annoyed me to no end.
Thorsbecken talks about COVID Dystopia, the animated short he entered in the Orlando Film Festival. First, though, it is 1 week out from Election Day. Early voting is happening now. Several constitutional amendments are on the ballot in Florida. Amendment 1 impacts the future of school board elections. If approved, candidates would be required to run with a designated party affiliation. Currently, school board elections are nonpartisan in the state. Patrick Rickert is assistant professor of political science at Rollins College. He joined Engage to explain the ballot language and impact. I started our discussion by asking Rickert what changes if Amendment 1 passes.
In 1998, Florida enacted a law that candidates for school board have to run without a party label. This would basically override that law. And so when candidates are running for school board, they could have an R or a D next to their name for their Republican or Democratic affiliation.
If Florida used to have partisan school board races and voters got rid of them in 1998, why now? Why is it back before voters now?
A lot of the reason that the current amendments are on the ballot across the board, including one, are because Republicans who support this amendment have a supermajority in the state legislature. You need a supermajority to get amendments on the ballot, and they can do so with few to no Democratic votes. So they're trying to get whatever priorities they can while they have that supermajority.
And this was put on the ballot by the legislature as opposed to being
Yes.
a citizen-led initiative. What are the arguments being presented to support and vote yes on Amendment 1?
Supporters say that this is about arming voters with as much information as possible. School board elections are what are known as low informational elections, where many voters choose not to vote for these at all, or vote at random if they don't have a lot of information about the candidate. A lot of voters make decisions based on cues or shortcuts given by the party label next to the candidate's name to get to about where they would have made a decision had they had all the information and done a bunch of research. So supporters say that giving voters this cue is going to help them make better informed decisions.
Conversely, what do people against it? Who are the no voters? What are they saying?
So opponents fear that this will inject partisanship into the election process. They say that school board elections don't have to have the same battles that we have over national politics. And not only that, if people are running with party labels, parties and dark money groups will then start pouring a lot of funds into these campaigns and supercharge an already polarizing election process.
Is there an argument that could be made that these races are already partisan, even if they don't have that formal R or D designated next to their name?
Absolutely. And in fact, this is something that political scientists have found pretty consistently in nonpartisan races across the country. For example, the Nebraska legislature doesn't have any party affiliations, but it's not some paradise of cooperation and bipartisanship. In fact, what the research shows is that without party labels, some of these candidates take even more extreme positions than they otherwise would, so they can prove their party affiliation even though it's not listed on the ballot.
So Florida is a closed primary state. If Amendment 1 passes, what does it mean for primary elections moving forward, and how would it affect the millions of voters who are registered as no party affiliation voters then?
Yeah, it would mean that they can't participate in choosing the party's candidates. Because Florida is a closed primary, you have to be registered with your party in advance in order to vote in the primary elections.
Could you talk about some of the impacts? Could this make things either more transparent or more divisive, more political? I'm thinking of a time when, school board meetings weren't so contentious.
I think it could have both effects. I think that the partisan politics that kind of surround our society right now aren't going away. And so pretending like these candidates don't have partisan affiliations is frankly untrue and hides information that voters could use to make their decisions. However, there has been some research on nonpartisan school board races that has found that when people run with a party label, they're more likely to take cues from their party and express opinions on these national political circumstances. So it could further polarize some of these school board meetings, especially around national issues.
That's Rollins College Assistant Professor of Political Science Patrick Rickert. Some of the amendments on the ballot are commanding the attention of Florida voters more than others. Initiative 6 proposes repealing the public campaign financing requirement for statewide candidates. Our discussion continues with Rickert parsing out the language of Ballot Amendment 6.
Florida established a program that provides matching funds for political candidates for their donations that they receive under $250 if they agree to expenditure limits of $2 per registered voter for gubernatorial candidates and $1 per registered voter for statewide cabinet candidates. This amendment would repeal that program and basically eliminate the matching funds for candidates. And in fact, this isn't the first time that voters have answered this question. In 2010, an amendment to repeal the program was also on the ballot and failed. It did receive 52.5% of the vote, but it was less than Florida's 60% supermajority requirement.
Why would a candidate agree to spending limits?
Especially if a candidate has a difficult time fundraising or is generally disadvantaged in the amount of money that they can raise. This allows them to get more money and compete with people that are maybe receiving more donations, especially candidates who are less popular, who probably won't even come close to the spending limit. So for gubernatorial candidates, the spending limit ends up being around $30 million and about $15 million for cabinet candidates. And some candidates are not going to reach that level.
What would a candidate have to do to qualify for that?
So the qualifications to receive this money is that you not be running unopposed, that you agree to the expenditure limits, that you've already proven your viability as a candidate by raising $150,000 for gubernatorial candidates or $100,000 for cabinet candidates, and you can spend no more than $25,000 of your personal funds on your campaign, and are faced with a limit from political parties of $250,000, as well as agreeing to disclosure of campaign finance information, basically who your donors are and how you're spending that money.
If it passes, would it give people who are independently wealthy an edge over candidates who are not?
Certainly. It would basically give candidates who can raise a lot of money, either if they're independently wealthy or backed by wealthy donors, the edge. And that's part of the reason that opponents of this amendment oppose it. They believe that this levels the playing field for candidates that might not have such rich backers.
Are there any other arguments that those opposed to it provide when they are encouraging people to vote no on Amendment 6?
Yeah, there's something called the cash ceiling that we talk about when understanding elections. And that is because elections cost so much money to run, it is basically a full-time job to run for office. And so if you need a full-time job to survive, you're not going to be able to run, and you're effectively barred from serving in public office. Opponents of Amendment 6 say that this helps us increase working class representation, that people who have other commitments and can't devote their entire career to fundraising will still be able to compete at these levels.
Is there any kind of evidence or way to quantify if the smaller donations benefit one party more than another, just in general?
It varies from election to election which party gets more in small donations. But the thing about this matching program is that in order to receive matching funds, you have to receive the donations in the first place that are being matched. So popular candidates are always going to do better no matter the election.
And can you explain who supports a yes vote on this? Who wants to see this pass?
Yeah. There are a lot of people that don't believe that public money should be spent on campaigns, and that by using this program, we're giving a lot of money to candidates that just don't need it. Ron DeSantis received a lot of money from this for his 22 campaign, which wasn't especially competitive. Voters especially are squeamish about their taxpayer dollars being spent in support of electing a candidate that they may disagree with politically. None of this, Amendment 6 passing or not, changes the fact that much of the money spent in support of major candidates comes from what are known as independent expenditures. That is money that's spent in support of a candidate, but not in coordination with the candidate. And so those aren't subject to the same regulations. So if you vote yes on this, hoping that it's going to get rid of money in politics, you might be severely disappointed.
Patrick Rickert is Assistant Professor of Political Science at Rollins College. In its weather outlook released this morning, the National Hurricane Center said it is monitoring the possibility of tropical development in the Caribbean. While the system is not a threat to Florida, it is a reminder we are still in the Atlantic hurricane season. It continues until the end of November. Earlier this month, Hurricanes Helene and Milton hit Florida back-to-back in less than 2 weeks. Most of us stay as far away as we can from those storms. I got a chance, though, to talk to someone who does the opposite. Josh Wadler is an assistant professor of meteorology at Embry-Riddle Aeronautical University. He flies with hurricane hunters to use cutting-edge technology to advance science. Their observations that go to the Hurricane Center can improve forecasting and understanding of the storms. He joins Engage to talk about his experience in the middle of Hurricane Milton. He starts our conversation by taking us back to the first time he boarded a plane heading into a storm.
My first flight was in 2017 in Hurricane Nate as a grad student. Hurricane Nate at the time was the fastest moving storm ever in the Gulf of Mexico. And so fast moving storms are very asymmetrical in the winds because the wind speed of the storm gets added to the motion when you're on the right side of the storm, and it gets subtracted on the left side of the storm. So basically the winds of the storm cancel out with the motion. And so during that mission, we actually measured a wind speed of 0 miles per hour on the left side of the storm. The storm was moving so quickly that the motion of the winds from the storm exactly canceled out how fast the storm was moving. That was a unique experience.
I want to talk to you more about why you're doing this, but I have to know more about what it feels like. And let me use Hurricane Milton. You flew into this earlier this month. Can you just paint the picture for me? Who's on board? How big is this plane? What does it sound like?
So the storm develops. There's a group of people that put in modules at the beginning of the year or experiments for what we want to do in hurricanes. And then there's a call, is anyone interested in doing research in this storm? And so we reply. And then based off of that, based off of priority, you get allocation of seats on the plane. So we're a pretty high priority project because we get funding from NOAA to do the work. And so there's 20 seats on the plane. It's a big plane. It's a very loud plane. If you want to talk to the person sitting next to you, you have to yell. So everyone has headsets on the plane. So you mainly communicate via headset or through chat messenger. And so when we're in the plane, there's a few people for our particular project. So we do the UAS work. And so typically there's one scientist on the plane, that would be me or someone else on our team. And then we have a UAS pilot. So we buy the drones, the UAS from the companies that make them. And so their engineers are the pilots for the drones. And so, of course, they don't know what we want all the time. And so, we're on the headset saying, oh, this looks interesting. Let's try to get the UAS over here, or let's try to go over here. Let's go with this altitude. Let's go with that altitude based on, our unique scientific interests. It's very tiring. So standard day is you get to the airport at like 1:30 in the morning. I was on the 4 a.m.s. So we have a 2 a.m. brief for the 4 a.m. mission. And then it's kind of really casual. They're like, be on the plane by 3:30 in the morning. So you just walk on whenever, just sitting on the tarmac, which is pretty fun. And you just walk on, and there's another pre-flight briefing about 30 minutes before takeoff, where everyone discusses, mission objectives, etc. There's usually a long ferry, but when you're in the storm, things happen very quickly, as you can imagine. And so it's better, everyone knows what the plan is, and everyone's on the same page, which is why I go through it multiple times. And then, of course, there are decisions made in the storm based off of what's there. The most surprising thing to me over the years is just how different a storm can look when you're in it than what you see on particularly on satellite.
Okay.
I think satellite images, particularly infrared satellite, are very misleading in terms of what the storm structure actually is.
What are you finding out being in it, in the storm, that those satellites and computers cannot? What part of the story are you bringing that those computers can't?
So a lot of times you'll see like an infrared image, which measures cloud top temperature, and you'll see a beautiful circle with a pinhole eye in the middle. And those cloud top temperatures are real, but they're just really high upper level clouds. So you get rising air in the eye wall, and then you get outflow, and you just get we call it a cirrus shield, right? We get really high clouds that cover everything. But, if you look at that to an untrained eye, you would think it's just raining everywhere because you're like, oh, there's clouds everywhere. But in reality, they're just high clouds, right? They're not deep precipitating clouds. And so, there's a lot more empty space, is what I call it, in the storm, which is really like shallow cumulus clouds in comparison to what you would think is there from satellite. And so sometimes it's even hard to, perfectly plan a mission because you don't know what you're going to get when you get there, or you don't know what you're going to see when you get there. And that's the importance of, scientists being there. And that's the importance of us flying the plane through the storm because, we get information you can't get otherwise.
When you were flying through a hurricane, you mentioned that it's really loud. You kind of have to yell at people on the plane. Does it feel different when you're in the eye versus going through the eye wall? Is it more rocky? Can you tell?
It really depends, is the answer. There are some eye walls that you would never even know you're in an eye wall unless you looked at it on radar and knew what you were going through. And there are eye walls that are extremely turbulent. Typically, the weaker storms have more random turbulence or randomly distributed turbulence. And in a strong storm, you can hit strong turbulence, but you know what's coming in the eye wall. So it's kind of more predictable in when you're going to hit it. And so it really varies a lot between storm to storm. And I would say from a human perception of it, it varies based on how busy you are. So I've been through eye walls, like I was in Hurricane Michael back in 2018 that hit the Florida Panhandle as a Category 5. And I was doing some work on the plane and we went through the eye wall. I had no idea. I was busy doing stuff. And they were like, "Oh, how was that eye wall?" I was like, "I don't know. I was busy."
So during your first flight to Milton, this was October 8th, it was a Category 4. The next day, your crew's second flight is Category 5. Is there a noticeable difference for you when you're in these major hurricanes compared to like a Category 1, or is it really just vary by storm?
It really varies. I mean, even the missions varied a lot, right? So on the first mission, there was a lot of turbulence. That was the video that went viral that Nick Underwood took, holding his GoPro, where we hit some pretty big bumps going into the eye wall. And then the second mission that we did was a really interesting mission. The southern eye wall was eroding throughout the mission. So it was well forecasted that the shear was going to increase, which was going to weaken the storm prior to landfall. And so on the first pass that we went through the storm, there was a complete eye wall, inner eye wall. And then when we came through a second time, probably about an hour later, the southern eye wall was completely gone. And so the winds were there, but there was no precipitation there. And I actually wrote about that to a lot of my colleagues because it presented a really unique opportunity to actually see the ocean in the southern eye wall, because it was still windy there like an eye wall, but there was no precipitation left. It eroded over the course of that mission. And so just like, that's just one unique aspect of one mission, right? And there's always something unique about every mission.
We're talking with Dr. Josh Wadler with Embry-Riddle University. Tell me more about the meteorology research that you're doing and what you're looking for when you're suspended in a hurricane.
Yeah. So the particular work that I'm doing is using small uncrewed aircraft, or UAS. So we deploy them from the P3 and they fly low. And that's the primary objective. So it's very unsafe for the P3 to fly right above the ocean for obvious reasons. And so the ocean provides the energy for storms to get strong. And we really want to understand that process. And the way to do that is to make measurements. And so I'm part of a team that uses UAS to really measure what those air-sea interactions are and how the near surface of the atmosphere is evolving in real time and how that influences the storm overall.
And just to wrap up, I'm curious, do you get nervous, or is this just part of what you do?
There's always a little bit of nerves. Obviously, you're flying into a hurricane, but we have full trust in the crew. Safety is always number one priority. They do everything that they need to do to ensure the plane is safe and rated for hurricanes. So, for example, there are cutoffs where they do have a knock it off criteria where they return home. That's 3 Gs vertical. So if we hit 3 Gs, they do turn around, for example. And so, full trust in the crew and the pilots and their training. I always say there's never, nothing has ever happened since the plane has been flying since the 70s. And so, obviously there's nerves, but full trust in the crew.
Josh Wadler is an assistant professor of meteorology at Embry-Riddle Aeronautical University in Daytona Beach. Coming up, a dark plot twist for a story that took decades to tell. A former Disney animator discusses his film being shown at an Orlando Film Festival. Just a reminder, we want to hear from you. Let us know what you'd like to hear more about or what you're glad you heard. You can send us an email to engage@cfpublic.org. This is Engage on Central Florida Public Media. You're listening to Engage on Central Florida Public Media. I'm Sharon Stone. Thomas Thorsbecken was an animator with Disney, working on such high-profile films like The Lion King, Mulan, and Lilo and Stitch. He had relocated to Orlando to work with the studio. 2009, he came up with this bold project. He was going to paint 1 watercolor a day, documenting the arts and culture of his new home in Central Florida. Thorsbecken was committed to the project and produced art every day for more than a decade. In 2020, the COVID pandemic hit. Life for every American changed drastically for 2 years. It was the reaction by some politicians and corporate communities that had Thorsbecken vexed. The pushback to closures and lockdowns, hostility towards masking and vaccinations. He couldn't understand why there was such pushback to those efforts to protect public health. That was when the Painting a Day project took a pretty dark turn. Thor Specken started to paint pictures of his interpretation of the response to COVID, often melding popular settings, including the Magic Kingdom, with images of medical personnel struggling to treat patients or mass gatherings of people despite warnings from doctors. The paintings accumulated until Thor Specken realized he had enough content to generate an animated short. So he collaborated with Orlando-based musician Andy Matchett to create COVID Dystopia, a 4-minute, 10-second-long animated short. COVID Dystopia has been touring the film festival circuit over the last year, racking up several awards. This film will be shown at the Orlando Film Festival, which kicks off Thursday and runs through November 7th. Thomas Thor Specken joined Engage earlier today to talk about his film. He started the conversation by explaining why he began his Painting a Day chronicle of the region's art scene.
That was a New Year's resolution. I thought I'd be doing it for a year to see how it went. I basically wanted feedback on what I was producing. My first drawings were of the streets of Orlando, and I thought that's what I'd be doing, just recording the city life. But people would stand in front of me and tell me, you should check this out. Why don't you go here? And so people sort of directed me towards what it eventually became. People told me what they wanted to see, and I went there and recorded it as an artist. I was doing that through the beginning of the pandemic. It was, 20 years, where I was just doing a watercolor every day of arts and culture, rehearsals, things like that. And in March, I think it was March 13th, the World Health Organization declared the pandemic. From that point on, the work changed entirely. It was I could not go to those venues anymore. So I had to do something else.
Tell me more about how your work changed in 2020. Were your images mostly positive before? Was it a mix? And how did it change when the pandemic started?
I would say all of my work, all the watercolors were light, colorful depictions of shows, rehearsals. So it was playful, fun work, and that entirely changed. But basically, it turned from doing a sketch on location to sketching locations I couldn't go to, but felt people should see. And it came from a place of anger, actually, that people could not adjust. Politicians could not acknowledge. Everyone wanted to minimize. So I pushed the extremes visually about what was happening to try and wake a few people up, essentially. That was my goal, and still is. I'm not doing as many paintings now. I sort of ended the series when the United States ended the emergency declaration, but I still do one once in a while. So that's how I bookended the series. I decided it ended then, but the pandemic didn't end then. Just people's acknowledgement of it ended at that point.
And you described your preoccupation with news as an obsession. Describe to me more, just how did you feel? Why did you feel that way, and how did it translate into your art?
Yeah, I wasn't following the news as much as an artist, just recording arts and cultural events. I was more interested in meeting actors and having fun on location. But from day one, it became clear that people were not able to adjust, and it just annoyed me to no end. So the work came from anger. The first image I created in the series was of Walt Disney World, Main Street, USA, and showed the 1918 pandemic, people in cots at those times. So I lined all those cots up down Main Street of Walt Disney World. It took them 3 or 4 more days to finally decide to close the park. But it seemed ridiculous they were keeping it open. And when they did close the park, they decided to hold a really crowded fireworks display, push everybody into a tight space. And that's how they went out.
Tell me more about how this all evolved into an animated short.
I saw a film on Instagram based on a Billy Joel song. It was artist AI. So it was computer-generated images of people and places set to the music. And I decided I wanted to make an AI film, but an artist-generated film rather than a computer-generated film. And then as I got into it, I thought it would just be stills that were cutting very fast. But then I realized I enjoy animating, and I started moving things. I started walking people and having a gesture in every single frame of the animation. It's not a linear story, but it is fully animated. Although there are crowds of people in every scene, so I don't always animate everybody because I'd still be working on it to this day if I'd tried to do that. But I would pinpoint particular things I wanted people to look at, like a person removing their mask or something in a scene. Everybody else is still, but with depth of field, that's the thing that I played with the most, is that each scene feels like it's in deep space, not just on a flat plane.
You're going to be showing COVID Dystopia at the Orlando Film Festival, which actually begins on Thursday. What do you hope viewers take away from COVID Dystopia?
And honestly, from the start, the whole goal has always been to just turn a few minds away from minimization, to try and convince people that this is something they should take serious. Even today, the pandemic is still ongoing. We're sort of in a valley now. We're coming down from the 9th wave of the pandemic. We're in a valley, but that valley is higher than the first 3 waves of the pandemic when everybody was in isolation. So it's going to be going back up again at some point. Basically, I'm trying to save people, trying to wake people up, trying to make them realize that this isn't something they should ignore. If their kids are going to their school, they should work to protect their kids by cleaning the air in the classrooms. Air should be cleaned in every restaurant. It's easy to do with filters, but nobody wants to do it because it'll cost a little bit up front. But it's simple to get out of the situation, but nobody is making a move.
And what type of response have you gotten to this animated short? Mostly positive, negative as well?
I think it's one of the most hated animated films ever produced, honestly. Very few festivals have been willing to show it. If you have one person on the jury that is conservative, they'll say, we can't show people this. I had to put a warning on the film when I first showed it at the Fringe in Orlando that essentially warned people to remove their kids from the theater if they saw the movie. And just the word COVID is often bleeped in any news articles. It's like something nobody wants to say, nobody wants to hear. But I'm putting it out there and keeping it out there because the situation hasn't changed. I would share each piece on social media in the beginning, and the response in the beginning was supportive in many cases. Many people agreed with my viewpoints. Others were absolutely hated what I was doing. There was never a middle ground. It's always, I hate it or I love it. And when the film is being shown in the few venues it gets to be shown at, it wins awards. But getting people to see and look is hard.
That was animator and director Thomas Thorsbecken talking about his short film COVID Dystopia. Thank you for joining us for Engaged. All Things Considered is next.